and thank you for joining us today for today's webinar, Supporting Survivor Safety and Choice Within Substance Use. This is the fifth and final in our five-part series based on our guide, Committed to Safety for All Survivors. And today we are hosted by the National Center on Domestic Violence, Trauma, and Mental Health. My name is Gabriela Zapata-Alma, and I'm the Director of Policy and Practice on Domestic Violence and Substance Use with the National Center on Domestic Violence, Trauma, and Mental Health. And I'll be today's presenter. Before we get started, I'd like to go over some technical details for the WebEx software that we'll be using for today's webinar. Many of these details are also explained on the tab that is called Using this Webinar System, and you can find that in the center of your screen. You can switch to the screen from the slides by clicking the down arrow next to where it says Using this Webinar. And please be aware that your screen might look a little different depending on whether you're using a Mac or a PC. On the right-hand side of the screen, there are multiple boxes. Third from the bottom is the chat feature. You may have to click on the chat cloud icon at the bottom center of your screen to open your chat box. This feature will allow you to provide feedback and share resources with your fellow colleagues, as well as to get in contact with myself and with Carla Alegria if you have any questions regarding the training content. You can also contact Carla, also with the center, if you have any questions around the WebEx. To do this, click the down-facing arrow and select the person that you'd like to contact. You'll see a lot of options. But for this session, you'll want to select all participants if you want to respond to a question that I posed during the session or to contact the center staff at any time. You can also click on Carla Alegria to privately contact her if you are in need of troubleshooting the WebEx software. So let's go ahead and test this chat feature. Will everyone please go to the chat box, click on all participants, and type in where you're joining us from today. Excellent. Thank you all very much. So while folks can get a lot out of the chat feature, sometimes it moves really quickly and it can feel distracting. If this is true for you, feel free to minimize the chat box by clicking the arrow next to where it says chat. You can always open it again with the same arrow. We will be providing live captioning during this webinar. Below the chat box, there is a media viewer box. This is where you will find the captions. And if you don't want to see the captions, you can click on the down-facing arrow next to the word Media Viewer, the same way you might if you want to hide the chat box. And we have built in time for a question and answer at the end of the webinar, so we'll be sure to save that time. And then at the very end of the webinar, you'll be taken to a brief survey. Please take a moment to let us know what was useful and what could have been better. If you get disconnected at any point, return to the email you received with the original webinar link and re-enter the training. And sometimes the sound cuts out because of the internet connection. So feel free to call in if that becomes a problem. And if you're experiencing any technical difficulties and you're unable to contact Carla, you can also contact the WebEx tech support to resolve any issues. That phone number, which Carla will post in the chat, is 1-866-229-3239. And again, thank you for joining us today. So we'll go ahead and get started now. There we go. There I am. So there you see me. I'm so glad to be here today with all of you. And for those who maybe I haven't had a chance to get to know yet, I help direct and lead the center's projects at the intersection of domestic violence and substance use. And I have over 15 years experience working with survivors who are using substances, who are experiencing mental health concerns or barriers, as well as experiencing housing instability. And I've worked in housing programs, and I've also worked in formal treatment. And then a little bit about our center. We are a FITSA-funded special issue resource center dedicated to addressing the intersection of domestic violence, trauma, substance use, and mental health. So we offer training and technical assistance, research and evaluation, policy development and analysis, and public awareness. And here's our information for our grant support, as well as our disclaimer that the things that we share on today's webinar does not necessarily reflect the official positions or policies of the U.S. Department of Health and Human Services. And at the center, we always start with our integrated framework, really understanding what informs the work that we do, our approaches, and what we're really rooted in. And so we are rooted in survivor-defined approaches that attend to self-defined physical and emotional safety, that are based in relationship and connection, and foster hope and resilience. And with this at our core, we then go forth and embrace advocacy and empowerment-based approaches, trauma-informed approaches, human rights-based and social justice-based approaches, all of which need to have an awareness of and a responsiveness to cultural, historical, and community context. And so everything that we talk about in today's guide in today's webinar can also be found in this guide, Committed to Safety for All Survivors, which is available on our website. If you haven't already checked it out or downloaded it, please feel free. Please share it with your network. And so if there's anything here that feels like, oh gosh, Gabriela said that, but it's kind of going quickly, or I wish that was written on the slide, chances are you can find it in the guide. So, feel free to jot down anything that feels meaningful. At the same time, don't feel like you have to necessarily catch everything I say, because I am going to be sharing a fair amount of information, but it's also in the guide. And then here you'll see that previous webinars that came before this one, all of which are based in the guide. Really, the only topic in the guide that isn't reflected in one of these 5 webinars is overdose prevention and response, which we actually do have a webinar on already that predated this series. That's why it wasn't kind of duplicated in this series. And so today, as the final session in this series, really integrates what we've talked about in the previous 4 sessions and then puts it into action. That said, if you didn't get a chance to attend one of the previous sessions, that's totally okay. You still will get a lot out of today, hopefully. And missing a previous session or going back and watching it later in our webinar library is really no problem. And so today, this will be our focus. We're going to deepen the application of the concepts that were learned in all of the preceding webinars in this series. We're also going to offer a more in-depth method for supporting survivors to safety plan around their substance use in the context of domestic violence. And then in service of that, we're going to include some different tips and examples for supporting survivors to create a plan that reduces risks related to substance use while also supporting their self-defined goals, including health, safety, and overall well-being for themselves and their families. So while I'll be talking about a lot of different potential strategies today, always remembering that any strategy that is used or is kind of offered, it needs to be freely chosen by a survivor, that it's never a directive or prescriptive approach. It's always one that is of collaboration, of offering, and of really just exploring and generating potential strategies together if and when a survivor feels that that's helpful. So there are absolutely times that we might offer this kind of support and the survivor says, no, thank you, not at this time, right? And that's all right. It's important for us to always respect that consent matters. So I start with this question, and I ask everyone to please reflect and then respond in the chat. What would happen if we based all of our services on a survivor leaving an unsafe relationship? What would happen? What would happen in our services? What would happen in survivors' lives? What would happen? We would lose clients and lose lives when they aren't ready to leave. Survivors would stop coming for help. We would endanger the survivor. We wouldn't have any clients. We would not be able to serve the clients. Yes, make their situation more dangerous. People wouldn't be able to benefit from our services. And we would alienate people who are either not interested in leaving or not ready to leave. There's a lot of people who don't have the financial support, right? There are a lot of real reasons, a lot of real barriers. And we would not be serving all of their needs. Absolutely. Thank you so much, everyone. And please feel free to continue adding in the chat. And so what we're going to talk about today is really how do we support survivors in their safety and in their choice using really the same kind of skill sets and non-judgmental approach and focus on safety that we use when we support survivors who, for whatever reason, remain in a relationship. So one thing that can be helpful is even just thinking about substance use as another relationship. And this really parallels how a lot of people even experience their own substance use or even describe their own substance use. I remember talking with someone who described their substance use like feeling like a warm hug, right? So really showing a lot of the relational needs that the substance use was meeting. I remember myself, a little bit of self-disclosure, when I was working in a convenience store and I was still smoking cigarettes at that point in my life, that when I'd go out for a break and I'd have a cigarette, that I would never really feel alone, right? That it was always like that cigarette was there with me somehow. And it might be hard to understand if that's not something that you've experienced firsthand. And that's where empathy is so incredibly important, and really the empathy and advocacy and justice, right, all together really form the core of our work. And so we want to think about this in the same way, that if we base our services on this all or nothing of leaving the substance use behind, then all those same things are going to actually be at increased risk. We're going to see an increased risk with potential loss of life. Absolutely. We know that there's a direct line between stigma and kind of, screening people out of services and there being risk of overdose and other things that endanger lives. We also know that, it's not aligned with trauma-informed services. It's not aligned with voluntary services, right? And that it's not effective. But if it were as simple as, Gabriela thinks you should stop using substances, so, magic wand, now you stopped, right? Then we really wouldn't be having this conversation. There wouldn't be decades and decades of different kinds of research and services to support folks who use substances in a way that that isn't aligned with their own goals and their own well-being. And so, notice wherever those kind of simple answers get tossed out, and notice when there's an oversimplification of what is often a very complex reality for folks. All of our realities are complex. That is, I would say, actually one of the beautiful things about life. So now, just how we talk about safety planning when somebody is either in a relationship or after a relationship, kind of either way, right? We're going to talk about substance use management. And so substance use management, which was something that was written about and first kind of coined and introduced by Dan Big. This is a collaborative, relationship-based model for supporting people who are currently using substances, including alcohol, and supporting people to make self-defined positive changes that decrease their risk and increase their health, their safety, their overall well-being, as well as that of their family members. And so, this approach really uses a lot of the same skills that we use in our empowerment model and in our safety planning in domestic violence. And it is not based on having any kind of formal credential or licensure or advanced training and counseling. This is something that is used by really peer-based support and just kind of lay people, kind of people in the community. And so, well, certainly something that can be used by a licensed or credentialed clinician, it's not necessary. So, the goals of substance use management are really supporting safety and well-being through developing a substance use management plan that really pays attention to and that prioritizes self-defined goals, including self-defined emotional and physical safety, stable housing, financial stability, health and wellness, and attending to personal and family responsibilities. And so really kind of so many of the services and resources that we are already offering align with this approach. And if you were able to tune in to session 4 in this series, you might remember Recovery Capital and thinking about all of the internal and external resources that help people in their journey of recovery, in their process of recovery. And when we look at the goals of substance use management, so many of these really map right onto what we know to be not only helpful in supporting people's safety, but also in supporting people's recovery. So what's our role within this framework or this approach? So our role is to build trustworthy relationships, services, and environments, to be able to foster open communication about substance use. And session 3 of this series could be really helpful if you haven't already tuned into that one or if you want to review it within your teams, because it's all about creating a program environment that is trustworthy and that fosters that open communication. Our role is also to focus on a person's self-defined preferences, goals, and solutions. And within that, to support any positive change as the person defines it for themselves. And we have come to learn through research that an all or nothing approach to substance use can actually be associated with experiencing kind of more frequent and more intense setbacks in a person's substance use goal. And that it's part of it, it's called the abstinence violation effect. And part of it is because then when somebody does experience maybe a setback or something doesn't go really how they had hoped or planned, then there can be this sense of really intense shame and self-blame and failure, and this sense of, I already messed up, why even try, right? And so that all or nothing approach has been found to really kind of set people up in some ways for potentially kind of worse outcomes. And so what we have found is really healing and really person-centered and really helps to generate kind of all of that momentum and hope and self-efficacy and empowerment, right? All those things that we're hoping to foster and support is supporting any positive change as the person defines it for themselves, not as how we define it or whatever our agenda is or someone else's agenda is, but how they define it for themselves. And then to highlight and build on strengths and successes. That a lot of times there can be this kind of natural problem focus or deficit focus that is, kind of just tied right into societal stigma around substance use, that there's this kind of idea that if we just kind of keep pointing out all the problems, that somehow people will feel really hopeful about, their being able to make some changes or being able to, feel kind of centered and grounded and hopeful, right? And that's just not the case, that we grow through building on our strengths, through building on our successes. That's what even gives us kind of the opportunity for hope, the audacity for hope, to feel in connection with our own strengths and successes, even when maybe we can't see it ourselves, to be in connection with somebody who sees that part of us, right? And how incredibly healing and powerful that is. So some of the perspectives that are a part of substance use management. So these are some of the kinds of viewpoints that are important and facilitate our ability to support people in this way. So first, embracing that there are many pathways towards recovery, that while we may share a lot of kind of common experiences in recovery, or in healing, or in, stability, however we want to describe that process, that there are just really so many different ways that people engage in that process, and that it's really unique to our situation, to our life, to our positionality and our culture, right? That it's unique in so many different ways. And so, of course, while our pathways may be shared and peer support can be so incredibly important, at the same time, it's important to recognize each person's kind of unfolding and each person's journey as unique as their fingerprints. And that recovery and healing is born out of trustworthy connections, respect, empowerment, self-determination, and timely access to desired resources, that we are respected in our decision-making, and that we're not kind of funneled or pushed onto a certain path or told, well, you have to go to treatment and then you can come here, or this is the next step in your journey, right? It's not prescripted, it's not directed, right? And that when people are wholly respected and honored in their decision-making, that then, if and when they find a certain resource, such as treatment, to be important, that then they will have that trusting relationship with someone who can help advocate, with someone who can help them access that desired resource. And we know that those resources are not always easy to access, right? Really, the goal is same-day access, and that exists in very few communities and for very few people. And that really that long-term stability is born out of the ability to explore and experiment with different solutions as part of the process of healing. So when I was a treatment director, I led a wholly harm reduction-based treatment program. And, meaning that we never told people what to change, how to change, when to change, right? It was completely person-centered. It was completely self-defined. And what we found was that even though we were harm reduction based, the vast majority of people at one point or another did select a abstinence-based goal, meaning like a goal stopping the use of substances. And this isn't unique to the program that I led. This has been found time and time again that when people are engaged in person-centered approaches and trauma-informed and harm reduction-based approaches, that they're much more likely to be interested in treatment resources down the road, and they're much more likely to engage in their own stability and their own recovery, however they define that for themselves, right? That recovery isn't just of substances. And so another perspective that is central in substance use management is that everyone already has a plan about their substance use, even if it is the organic plan. And so I would often introduce substance use management and kind of planning around substance use kind of with this information. You know, people already have a plan around their substance use, even if that plan is somewhat maybe simple, like, well, I'm going to use in order to feel comfortable and try to avoid whatever negative kind of side effects that come along with that, right? And so people already kind of have this plan, even if they haven't kind of necessarily named it, put words to it, that plan is intuitively there. And so it's not that we are coming into, you know, chaos and trying to organize it into a plan. No, no, no. The plan already exists, whether or not it's been named. And so what we're trying to do is just partner with folks so that they have more of a kind of sense of choice in naming their plan, and then from there, kind of adjusting their plan with those goals in mind of stable housing, of attending to their personal and family responsibilities, attending to their safety, to their health, to their financial stability, all things that people, you know, at our root, we need and we want for ourselves, right? And then always empathy. Always approaching people with empathy and not approaching people with judgment. So this takes us being really self-aware and doing the work ourselves and doing the work in our programs and in our teams to really eradicate the stigma. And so this is something that is ongoing, and that reflective practice and supportive supervision are really important elements of. And at the center, we actually have several different resources around reflective practice and supportive supervision. So feel free to check out our website. If you have any trouble finding any particular resource that I mentioned, please always feel free to reach out to myself and I can help get that to you. And it goes without saying that, you know, all of this is built on the absolute worth and dignity of a person always being honored within every aspect of our programming and at every phase in their recovery journey. And that recovery is not born out of external control or adverse consequences. If it was, again, we wouldn't be having this conversation. There would be no substance use concerns in our society anymore, because there certainly has already been many attempts at external control and adverse consequences. So now moving into the 4 main steps. So step 1, overcoming all or nothing thinking. I already mentioned, right, kind of how harmful the all or nothing thinking can be. And so here the first step is just expanding our own awareness of the many ways that people can improve their lives through their own self-defined goals. And that moving beyond that all or nothing thinking is essential before we can do really anything else. The second step is creating an environment of free choice And again, session 3 can be really helpful. Session 3 in the webinar series can be really helpful to take a deeper dive into this. So this is all about creating a programmatic environment and a relational environment that supports survivors in making their own decisions. So this requires us as programs and as service providers to recognize and resist any instinct to persuade someone in regards to their substance use, and instead to focus on what they define as their needs, their goals, and their preferences. And then step 3, now we have kind of what we need to really collaborate in self-defined goals. So within that environment of free choice, we can offer, we can encourage people as they consider their options and experiment with different potential strategies to support their self-defined goals. If someone is maybe drawing a blank or kind of struggling with what might be useful or what some potential strategies might be, we can ask them what they've tried in the past. We can talk with them about what they have found helpful or not helpful in the past. Ask them if they know other people who have had similar, situations and what they've tried, right? I've also sometimes even asked people, if you, if a close friend was facing a similar situation, ask your advice, what might you say? Sometimes just getting out of our own kind of head, out of our own situation, and engaging our empathy for someone we care about can also be helpful in generating, brainstorming different solutions. And then with their permission, we can also offer examples of what we've noticed other people in similar circumstances try, or what other people have found helpful, right? And this is where a peer-based support can also be so incredibly important. It's always important, I would say. Not that we would ever foist it on anyone, because we're not in the business of foisting things on people. That's not healing, right? That's re-traumatizing potentially. But this is also where having some peer-based support can help us naturally just tune into some kind of expanding the possibilities of just what's even possible, what it can even look like, right? And then step 4, evaluating impact and reconsidering strategies. So here is where, as we kind of create that, that substance use management plan, that, safety plan that integrates attention to safety needs around substance use as well as domestic and or sexual violence. So as we kind of have created that plan, or the person's created it for themselves, then from there, being able to have those supportive conversations around how's it going, and is there anything that isn't quite, going the way that we thought it would go? Is there anything that might, what have been the successes, right? How can we celebrate those? Really honoring and celebrating any positive change as a person defines it for themselves, as well as just reconsidering what are some strategies that the person thought might have worked, but you know what? It turns out that it wasn't a helpful strategy after all. And this is especially important when we integrate attention to safety when it comes to interpersonal violence, because sometimes strategies that can help our safety related to substance use can increase danger due to domestic and or sexual violence, right? There can be a tension there. And so sometimes some of the safety strategies that someone might come up with around their substance use might not end up being realistic or accessible for them because of the way that the substance use coercion, the mental health coercion, and the overall domestic violence has been shifted to try to exert power and control over them and kind of prevent them from using that safety strategy. And so this is where kind of that follow-up and that ongoing support and just checking in, right? So it's not like it's not like we're forcing people to check in if they're like, you know what, I'm not really trying to talk about that today. Okay, great. Thanks for letting me know. It's always important to focus on whatever a survivor is focused on and finds important, right? So within that survivor-defined choice, offering those natural follow-ups and those natural check-ins to kind of rework that plan as needed. And so throughout this process, we continue to approach a person as the expert in their life. We continue to validate their perspectives, and we continue to really highlight and reflect back their own work, their own courage, their own creativity, and their own power. So, that's now the building blocks for substance use management. But what else is helpful, right? That's not all. So what else is helpful is being able to offer information, resources, and individualized support around mitigating any of the potential harms associated with substance use. Also, knowledge of drug settings and stages of change. And I'll do like a very, very brief recap of both of those in today's session. And then there's much more in-depth exploration of both of those in previous sessions in the series. And of course, knowledge of domestic and sexual violence, including coercion related to mental health and substance use. For folks who are maybe feel like it would be really helpful to learn more about different substances that are commonly used, about different potential safety strategies related to specific substances, here are a bunch of fantastic resources that are available, and some are based in the U.S. and some are based outside the U.S. as well. So and these can be so incredibly powerful just to be able to openly share with people. I remember working with a survivor. I remember supporting a survivor who was being injected substances by a coercive partner. And so one of the things we talked about, one of the things I offered was, there are some different potential kind of health risks with injecting, and would it be helpful to just, have some information on some different things that you could do to take care of your veins, right, to really support your vein health. And he said yes, absolutely. He was very interested in that. And so we actually looked at the resources here on Better Vein Care that you see here listed under the Chicago Recovery Alliance. And looking at those together, it was so incredibly empowering for him, and it was so motivating for him in just his overall well-being, that while we were watching, and it also really strengthened our relationship, that able to really see that I wasn't there to judge him. I wasn't there to try to control him or push my own agenda. I wasn't there to try to preach about or lecture about the dangers or, try to kind of persuade him in any way, but that I really just wholly accepted him and his situation and was there as just a caring support, right? And so, in watching these, one of the things that he shared with me was that, it was so kind of eye-opening for him and understanding this information, and that he really wanted to switch to another route of administration, another way of getting the substances in his system that wasn't injection. And for those who don't already know, that is, injection is one of the forms of getting substances into our system that can carry the highest risk. And so him moving to a different route of administration was really, really a positive step that he identified for his overall health and well-being, and then also for his safety in the relationship that he was in at that time, because being injected by a partner also meant that he didn't always know exactly what he was being injected with, that he didn't always exactly know how much he was being injected with. And you can already hear how all of the different ways of exerting power and control over a survivor kind of come into play when they're being injected by a partner who's seeking to exert power and control over them. And so at the same time, that was something that only he was the only person who knew whether that was something that was actually a safe strategy for him. Because there are going to be times for, someone that if they even suggested that would really increase their danger, that would not be an accessible or safe strategy for them. So really, again, remembering that there's no magic wand, there's no I'm going to show this person better vein care, and then they're going to switch to a safer route of administration. No. But there's no simple solution. That it's really about being with people, being with them in ways that are truly healing and transformative, and supporting them in their own self-defined solutions. And that is the magic wand, right? And that all of these strategies need to be self-defined and self-chosen, just like they are in safety planning, right? So here is drug setting. And so just to recap, and we go into much deeper in this in session 2 in the series, but just to recap, the drug is the substance itself, including alcohol, how we get it into our body, so the route of administration, how much we use, and ultimately what it's doing in our body, including our brain. And so some substance use management strategies that are specific to the drug kind of slice of the pie is things like reducing the amount of substances that is used or reducing how frequently someone uses. Now, we also have to be aware for opioids, and that can really change the tolerance and can increase overdose risk. So we also want to be sure that we understand what is overdose risk, what are the risk factors, what are the protective factors, and to support folks with overdose safety planning. Other strategies that are common here for substance use management are things like avoiding mixing substances, so avoiding the use of more than one substance at a time, or maybe stopping the use of one substance while continuing to use a different substance that maybe is the person finds to be less problematic in their life. We already talked about changing from a more risky route of administration to a less risky route of administration, like changing from injecting to snorting, for example, better vein care, of course, and then just safer use in general, meaning, safer injecting, safer snorting, or safer inhaling practices. These can be especially important to share, or I should say offer information to survivors, because many times for folks who are experiencing substance use coercion, part of the coercion can be kind of forcing unsafe or more risky use as a way to threaten or intimidate or control. And so, being aware of safer use practices and materials and helping to share that information, as well as having access to those safer use can be really, really important for survivors' safety, both safety from substance use and safety from the coercion and the abuse. We've heard that time and time again from survivors. Then going into set. So this is everything inside of our body and our mind. So our mindset, how we're feeling before, after, during the use, our kind of outlook, our physical health. So if we have any physical health conditions, or whether we've eaten that day, or whether we've slept well or not, as well as some of our own cultural attitudes around youth. If it's a big source of shame for us, a big source of self-blame or guilt, shame and self-blame and guilt do tend to increase riskier use. So just kind of bearing in mind, right, that tends to drive that, that riskier use, because that becomes part of that self-soothing, right? And so some of the strategies specific, some of the substance use management strategies specific to SET could be things like supporting a person's physical health and their self-care, supporting their emotional safety as they define it. So we do have several guides on emotional safety planning and guide to emotional support. So those can be really useful here, as well as you know, just helping, offering kind of to explore with a survivor some of the kind of reasons why they may use, what does substance use help them with, how do they feel about it, what do they kind of hope to get out of their substance use. For example, is it addressing feelings of panic or having trouble sleeping, or feelings of anxiety, or feelings of numbness, right? Like, what is it kind of helping them with? And having a really deeply and empathetic approach to that, not a judgmental approach, not a sympathizing approach, but an empathetic approach. So some of the strategies here are things like increasing healthy nutrition, ensuring food access, helping people to engage and navigate wellness care and their medical care, helping them engage in any kinds of resources that they're interested in around mental health care, substance use care, if that's something that they're interested in. Helping to be curious and explore a person's frame of mind they're seeking to use. Are there certain frames of mind that lead to riskier use? Or what factors tend to lessen that risky use? So for example, if someone's feeling really like a lot of shame and numbness, is their substance use kind of riskier versus if they're using with a trusted friend and are using just to kind of pass the time, right? Are those situations tend to be different. And so exploring some of those situations if and when somebody is interested in having us explore that with them. Considering the benefits of use, so like what's it helping them with, what are they hoping for when they use, and then exploring other ways to experience that same benefit of use. So if, for example, they're seeking to feel calmer or more in their body, more connected when they're using, then, you know, what are some things that we could offer, not necessarily to like replace the substance use. We're not here to kind of try to control somebody. We're just not. That's not healing. But to help just offer additional options. And so sometimes I have literally said to somebody, I'm not here to take your drugs away, right? What I can do is help just expand what feels like options, what feels possible, so that, you know, if and when you are using substances, it's not because you feel like there's nothing else you could do, right? So just kind of expanding those options. And as the healing takes place, we will naturally just see the substance use stabilize, right? As safety comes into place, as the healing takes place, the substance use will typically stabilize as well. And then when it comes to settings, here are some pieces where, and let me say one more thing about SET. Really having anti-stigma approaches, super, super important, and helping to address and neutralize any kind of shame or self-blame that people feel. And this is very often tied up with the effects of trauma and living in a society that is so incredibly victim-blaming, right? And so that's something that we kind of do all the time anyways as advocates, and just extending that to some of the stigma and the shame that gets really put on people when they use substances. And then setting. So this is all of the social and kind of physical environments, everything around us, including kind of cultural, societal narratives around substance use. And so the main kind of strategies in the setting quadrant or slice of the pie is going to be really focused on supporting responsible decision-making and safety for a survivor, for their children, and for community members. And so some of the examples for setting specific strategies are separating substance use from other tasks, such as driving or work or potentially family responsibility. Helping to create a safer use environment by planning around where they're using, so the location of use, people who are around during use or who they're using with, how substances are obtained or stored, and then how any kind of drug use paraphernalia is stored or disposed of. And then creating a plan for managing responsibilities during use, as well as any time that they need in kind of the, recuperating from use. So planning for that as well, like if someone is going to need to sleep or, something like that. And then some other strategies that can be important here are relationship building, supporting with just community connectedness, conflict resolution, and expanding safe social supports. And then also for anyone that might be doing community training of overdose reversal, that would also fall under this slice. And then I'm going to do a much quicker recap of stages of change. And this was, we did a deep dive into this in just the last session, session 4. And so also remembering what might be helpful based on where someone might be in their substance use journey. And that how we show up with someone can have a really direct impact on whether they find us to be someone who is non-judgmental, who is helpful, or someone who is not offering anything relevant and maybe even judgmental, right? So this can make a really big difference. And whenever I found that, like, something's going on here, whatever I am trying to do is just not connecting, and that's on me, right? Because I'm the person there who's offering assistance. That's on me to figure out. That it was always really helpful to take a moment and reflect on what change might this person be in this moment around this particular substance, and then what am I doing to really meet them where they are? What am I doing to really actually show up in a way that is relevant and potentially helpful? So if you just take a moment, it's a lot of information. We're going to take a moment and just kind of get back into our present, situation, get back into our bodies, get back in touch with the moment. And then I want to share this mind-body practice. And it's something that can be done really anywhere, anytime. It can be done really discreetly. You don't have to close your eyes in order to do it. So it can be done really while we're doing lots of other things. And it's something that we can use and share freely with team members, with survivors, with community members. And so that's something that's really beautiful about these mind-body practices. And remembering that, trauma is encoded in the body. And so much of substance use for many people, I'm not going to paint with a broad brush and say everyone, but for many people, there is a piece, when they have had experiences of trauma, that the substance use is deeply connected to self-soothing. And so really building out that self-soothing and that kind of co-soothing toolbox is a really important resource for us as advocates. So I've already talked too much. Let's go ahead and take a moment and do this together. So with one hand, just firmly and completely envelop one of your fingers. You can choose whatever finger you would like, and here on the slide, it points out different fingers being related to different emotional experiences. So the thumb being associated with grief, with crying, with emotional pain. Now, don't squeeze too hard. It shouldn't hurt. It should just be firm, right? The index finger being associated with fear, with panic, with terror. The middle finger, I think you can all guess what this is associated with. It's associated with anger, with rage, with resentment. That's an easy one for me to remember. The ring finger, worry, anxiety. Oh my, has it been a year of worry and anxiety? I think all of us could use some of this finger holding of the ring finger. And then the small finger, the pinky, lack of self-esteem, which we know that trauma, one of the greatest harms that can cause in our lives is the chaos in our self, being in touch with ourselves, with our self-image, with the beauty of who we are. And so this comes from Capacitar and their manual on healing trauma and empowering wellness. If you're curious about this and other mind-body practices, I really encourage you to check out that manual. It is such a great resource. So now we're gonna, in our last half hour, and I am gonna leave time for questions at the end as well. So if I have two case scenarios, Alicia and Sabrina. And if we don't have time to go through both of them, then I invite you in your teams to do the second one together, to walk through it together and have a team discussion around, what are the potential substance use management strategies here? How might you approach conversation? And even feel free to role play, just different interactions, right? Although sometimes people can feel like role play feels a little funny or, might be cheesy, or it's just like, oh gosh, I'm so exhausted. I have to pretend now. At the same time, we want to be able to get the skills kind of into our muscle memory, and that most adults, we learn by doing, right? How do we learn to ride a bike? Not by watching a video of riding a bike, right? But by riding the bike. And so, we learn by doing. And so I really do invite folks to use all of these resources and use them to really take deep dives in your own teams as well. And if you have any questions about how you could do that on a team or program level, or if you're in a coalition and you want to build out, a training using any of these scenarios, please feel free to use these resources, and please feel free to consult with me, and I can help you kind of adapt them to your community context. So Alicia. So this is Alicia part 1. Alicia also has a part 2. And I'll just read it out loud, and then we'll go through the situation together. And I should say that these scenarios are totally made up. They are not based on any particular, person or people or anything like that. Alicia recently called the hotline after being attacked by an ex-partner near her home. She declines legal resources, stating that she's been down that road before, and no one believes her once they find out that she was drinking. When meeting with a community advocate, Alicia shares that she's very isolated in her rural community. She shares that her closest friend lives an hour away, and it's hard to visit her since she doesn't want to risk another DUI, another, driving while under the influence. Still, she sometimes takes that risk because she feels so lonely. Alicia shares she drinks around 12 beers a day, starting in the morning, and that she often doesn't eat a meal until the end of the day. She shares that she started drinking more after being laid off recently, but that she doesn't drink as much when she's with her friend. So here we just, in these few sentences, we've learned a lot about just Alicia and how alcohol kind of shows up in her life, right? So now we're going to organize it into drug, set, and setting so that we can have a sense of what are some of the potential substance use management strategies, always remembering that they must be that our approach would still be one of collaboration, of brainstorming, of offering to brainstorm safety strategies together, because these do really need to be individual and self-defined and survivor-driven. But being able to kind of pull apart these different aspects helps us to see a lot of the different places where we might ask some questions or where we might kind of offer some additional resources or support. So first is drugs. She usually drinks around 12 beers a day. The set, so both her physical health and set and her mindset, she's not eating regular meals. So she's eating, usually at the end of the day. And she's experiencing loneliness. She's naming isolation to us. Then in her setting, she usually begins drinking in the morning. There's ongoing violence and abuse from an ex-partner. She was recently attacked by an ex near her home. She's socially isolated, both relationally and geographically. She was recently laid off work, so that tells us something about potentially her financial stability as well as just kind of the structure of her day, right? And that she sometimes has driven while under the influence, although it is something that she does try to avoid. So I want to hear from you all. What are some potential kind of safety strategies that would be, obviously Alicia isn't a real person, so we can't really ask her. We can't start by asking her. But what are some safety strategies that are aligned with substance use management that you might just consider or brainstorm? Yes, exploring the option of the friend visiting or Zooming. Absolutely. Connection, so important. Yes, supporting her nutrition, supporting her food access. Absolutely. Exploring social possibilities locally. What are some opportunities for social connectedness? There may be a whole lot of things that she just never even had the chance to plug into that is different now that she has experienced being laid off. Alternating a non-alcoholic drink with the beer, so maybe adding a cup of water for every serving of beer that she has. Or potentially looking at the beer, what is the percent of alcohol by volume there? Is it, not all, some is going to have a higher percent of alcohol, a higher alcohol proof. So maybe looking at a beer that has a lower alcohol proof. Absolutely. Yes, making sure she has a support system. Yes, absolutely. And if I missed yours, I'm sorry. The chat's moving a little bit quickly. Let's see, career exploration and connection to community resources. Yes, we know that there's been a big change in kind of her employment and her potentially her financial stability, and looking at that. Coping skills, supporting that coping. Yeah, looking at, are there people in her life that she doesn't tend to use when she's with, or, you know, drink as much? And are those people, does she feel safe with those people? How do we help kind of increase and introduce more of those safe social supports and activities? What can help her feel safe? Yes, 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 yes. Beautiful, everyone. You can't see me, but I'm clapping my hands. I just realized I was clapping my hands, but nobody can see me. And so some of the pieces I'll add here, and please feel free to continue adding in the chat some different strategies, as well as some different resources you might connect or offer to connect her with. Oh, getting her a puppy, yes, yes. Oh, animals can be such an incredible support in our lives. It's so true. It might be a great time to get a puppy. Good time to house train a puppy. So some of the things we might look at, right? Reducing how much alcohol she's drinking. So she might decide to cut back from 12 beers to 10 beers, right? Or reducing the amount of time she's drinking alcohol. So she's starting to drink in the morning. What would it be like to maybe delay until the afternoon? Would that give her a window to maybe be able to drive and, you know, take care of things that she wants to take care of, maybe visit, you know, her friend or do some other things, and then just delay the start of that drinking? And that's an important question to ask, not something to just prescribe, because it may be that she's also experiencing withdrawal in the morning, and that's why she's starting to drink in the morning. It may be that her stomach is in knots because of the alcohol withdrawal in the morning. And so if that's the case, there are potentially some different other kinds of health resources that might be helpful. Oh, I love this. Working on a different routine throughout the day with her. Yeah. Building in those routines that really support our sense of connection, of safety, right? Those healthy routines. And I want to say sometimes healthy is a word that people experience as judgmental. So even though I just, you know, use the word healthy, I want to be aware that people get to define that for themselves, right? Because otherwise it can just become another label. And then working on doing activities that provide her joy and happiness. Yes, so important to build in that joy and that happiness, and that sometimes the things that we feel like will help us feel better, we end up feeling really numb during. Like, I remember so often talking with folks about how they would, you know, turn on the TV thinking that it was something that would kind of bring them a sense of happiness. And don't get me wrong, it certainly can. Oh my goodness. The other day, I don't know why, I just had a hankering for watching a comedy movie. And I'm the person who loves like suspense thriller movies. I'm not usually into comedies, but I just had this like craving to watch a comedy movie. And it was so, all that laughter was so incredibly healing. It was just like what my spirit needed in that moment. So not to say that the television can never be something that is a source of happiness or can, you know, lift our mood. But what I found a lot of the time working with survivors is like the TV went on, and then at the end of watching TV, they just felt like more worn out and more numb and more just kind of like bored and disconnected, and that started noticing what were the things that did bring that sense of joy, that sense of happiness and connection, right? And that can be so incredibly powerful when we have the opportunity to really reflect and notice those things in our lives, and then intentionally kind of build them into our daily experience. And that's such an important part of supporting folks and connecting to ourselves and our communities. Yes, absolutely. I see here in the chat, looking at building community, maybe through group, through church or faith community, is ultimately connection with others. Yeah, absolutely. And then, so some more potential strategies here when looking at the sect part, exploring what she finds helpful or beneficial about drinking alcohol. Is it numbing feelings of physical or emotional pain? Does it reduce her sense of isolation? Does she notice any differences in how much she drinks or how, what her kind of reaction to alcohol is when she is drinking alone or versus with her closest friend? Does she find that she drinks less when she's with her closest friend, or maybe, it doesn't feel as painful or as lonely, right? And then also, how is her experience of alcohol use different when she eats food? Is there anything different on the days that she eats versus the days that she doesn't eat, right? Is it an emotional state of being? Is it a just not having access to food? What helps her eat on the days that she eats? What's kind of going right, and how can we build on that, right? And then is there a way that we can build in kind of a positive association that involves increasing her food, increasing her eating while she is drinking alcohol, right? Is there some kind of routine that we can build in there? And then I see here, how could you explore other options if the person is wanting to numb, right? So a lot of times, that's a really, really great question. Thank you. And so when someone is wanting to numb, what I have often found is that they want to turn down the volume on the pain, but they don't necessarily want to turn down the volume on the happiness or on the joy or on the sense of self. But that when we're trying to block out the pain, we often end up blocking out the joy and the sense of self as well, right? Because we build up this barrier and it kind of blocks out the things we want as well as the things that we don't want. And so here, something that is really helpful will just be expanding that coping, right? And that building on what already works for the person, being able to ask them, what are some things that help you feel better? Even if it's with the alcohol. I remember working with somebody who loved to draw and was a really very creative, very much an artist. And so it was okay, drawing brings that sense of peace, right? And then, we're not going to focus on taking the alcohol outside of the art creation. We're just going to focus on building in more opportunities for art creation and really highlighting that that source of of really that source of strength, right? And then the alcohol will in many ways fade away as it's no longer needed, right? And for that person in particular, actually, they found that they got to a point where they no longer needed the alcohol, but then were experiencing cravings while art making. So then they actually asked for some help in finding some other activities to kind of take a little bit of a break from the art making while they navigated some of those alcohol cravings. And then after they had kind of built up their tools, they went back to art making and found that if and when those cravings came up, they kind of had the tools to navigate those cravings and that they could really just enjoy continuing to make art. Now, that doesn't mean that everyone needs to take a break or everyone needs to do this or that, but just kind of giving an example of what that could look like for someone. And that the most important piece is that the person is the expert on their life and that they see us as that source of non-judgmental support and that source of caring support to help them kind of navigate whatever is coming up, right? As those needs evolve, as they change, as the preferences and goals evolve and change, that they see us as that kind of non-judgmental and caring support. And so if someone's wanting to numb themselves, I would really explore, is it about being able to really tune out? Because sometimes we do need to tune out. And what does that mean, right? Does it mean watching TV? Does it mean putting on music really, really loud and kind of dancing around, right? Or does it mean that we just need to kind of like get out of our heads for a moment, and what helps there? I'm going to tell you, I'm a tree hugger. I really love hugging trees, right? And so what always starting with, what do they find helpful? What are their ideas? What might they try? Could we try some things together, right? And then, so some things for setting. I want to be sure to talk about that as well. So while we come in without an agenda, our agenda is really about being survivor-centered, right? So while we come in without an agenda, we do want to have some ideas around what might be helpful. And so one of the things that stands out right away is being able to separate any use from driving, right? And so we already know, Alicia has already said to us that she doesn't want to drive while intoxicated, right? And that, sometimes she finds that that's the only kind of option she has, given everything else in her life. And so this is where, right, us as fierce advocates, as people who are resourceful and collaborate with survivors in resourcefulness and in creative strategies, this is where we're going to be really brainstorming together. What are some of those alternative means of transportation available in her community? Is she able to kind of schedule the alcohol use for a time that is different from when she's driving, so like driving first and then having the alcohol use later? I loved the idea of seeing, can her friend come visit her, right? What are the possibilities there? And then something else that would be potentially important is to remove all alcohol from the car. If there's any alcohol being kept in the car, to make sure that, or I shouldn't say make sure, we're not here to police people, but to kind of offer and ask whether they're, sometimes people have forgotten that they even have some alcohol in the car. Have you cleaned out your car lately? Because then if she were to be, stopped for any reason, even if she hadn't been under the influence in that moment, if one of her goals is making sure that she is avoiding a DUI, then, if she has alcohol swirled away somewhere in the car that she doesn't even remember, then that DUI, could become an issue, or having kind of open intox in the car. And so asking around that as well. Some other things that can be helpful here, exploring how she obtains alcohol, and how does that impact her personal safety. So does she tend to go to the same store at the same hour? And so the ex-partner has kind of figured out a pattern and is stalking, right? Does she tend to purchase alcohol in bulk with the thought that it's going to last several days, but then does she end up drinking more than she planned? Would a potential strategy be buying smaller amounts of alcohol so that she doesn't drink as much in a given day? Or would that increase her risk because that means that she's going in and out more and potentially increasing her risk from a DUI or from being stalked or, attacked? And then what are some, safety planning around substance use coercion? Are there safety risks to consider when she runs out of alcohol, right? What is that like? And then, so some program considerations here. Well, let me say a couple more things. I'm going to jump ahead here because I want to make sure we have time for questions. And I have an eye on the time here. So in part 2, we find out a little bit more about her current relationship. So she's recently started dating someone who lives several hours away. She wishes he lived closer so he didn't have to stay several days at a time when he visits. She shares that by the end of its visit, she feels like she's walking on eggshells, even though nothing major has happened. When the advocate asks if Alicia notices any differences in her drinking when her significant other is visiting, that's an important question. Alicia shares that she drinks a lot more when he's around. When asked why that might be, Alicia shares that it's probably because she feels nervous and doesn't want to give him a reason to call her crazy again. She also shares that he expects her to drink hard liquor with him so that they can, quote, be on the same level, and that the hard liquor is a lot stronger than the beer she's used to. So in purple, you see here the pieces that we've added to drug set setting, right? Drinks, quote, a lot more hard liquor, 2 to 3 days at a time. She's not sure how much, right? In her mindset, she's feeling nervous. She's walking on eggshells. And then within her setting, the significant other visits for 2 to 3 days at a time, expects her to keep up with his alcohol use, and has called her crazy, which we know is a very common form of mental health coercion. And it's just part of the abuse and the gaslighting, right? So then here, of course, so incredibly important when we are supporting someone with substance use management to talk through, what are, if she was to drink less, right? If that was one of her strategies, then how might that play out when the significant other is staying? And would those strategies need to be slightly different when he's staying, right? Sometimes a person has said, well, I can add more, I can add more mixer, or I can water down my drinks, and that is safe for me, but I have to remember to act as intoxicated. Other times people have said, oh no, if I even try to suggest making the drinks, that'll be a problem, right? That's not something I can suggest. But even just having the wheels turning around, what are some signs, what are some safety strategies, and having kind of the ongoing conversation around what are some of those potential strategies that can increase safety around substance use and also increase safety around substance use coercion and domestic violence, because we know that they are intertwined. They're not two different things, but they really are one and the same. They're really complex ball of wax for survivors who are experiencing this constellation of power and control. And that all of that is intertwined with emotional safety. Of course it is, right? So I see here, she might be feeling that she cannot express her boundaries. Yes. Or she may drink to stay safe. Yes, absolutely. And so we know that there's a lot that people can do, even if they don't change the amount that they're drinking. There's a lot that they can do to still increase their safety around the substance use. Like drinking more water, eating more food, engaging in wellness care, having safe social support, having more of those coping strategies, especially things like just building on whatever that person finds helpful, helps them to feel safe and connected. And also, actually something as simple as adding a multivitamin every day, because alcohol use can lead to certain kinds of vitamin deficiencies, right? So even things like, and then those vitamin deficiencies can lead to like skin conditions, or can lead to feeling more nervous. And so, there's a lot of things that we can do, even if it doesn't feel like, or the reality is that any changes specifically to their substance use and that drug slice of the pie wouldn't be accessible at this time, or aren't desired at this time, right? That small changes in any one of these other areas can have large ripple effects on overall safety and stability. And I see here in the chat, great option, exploring options of the significant other staying in a hotel overnight. Is that an option, right? And then, so I want to be sure that we are having time for questions. So I'm going to pause with the slides here. And I would just invite everyone to answer this one question. So just reflecting on Alicia's situation, what additional tools and support and resources would help you and your program to support Alicia? And I'll just mention some kind of program considerations that we haven't mentioned yet. You know, how are we helping Alicia reduce potential feelings of guilt, shame, and self-blame? And how are we actively listening with empathy, responding with validation to help reduce any of that self-blame that she might experience? And then just thinking about if there's anything, one more thing I haven't named is, does our program have a policy on someone driving to our services while potentially under the influence of substances? Does that policy need to be clarified or created? And how do we share that with Alicia so that there's transparency? It doesn't come as a surprise. And then if needed, how do we support Alicia in creating a realistic plan to avoid driving while under the influence? Can we meet her in her home? Can we, what does staff need in order to have home visits, right? What kind of support does staff need? And then what kinds of safe social supports might be helpful and what might Alicia want to kind of include in her safety planning? So we know that she has a really close friend that she misses and loves to visit, right, who's about an hour away. And so would Alicia like to include this friend in our services and in safety planning? All right. And then here's the second scenario. We didn't get time to talk about Sabrina and her situation, so feel free to use it for your team meetings. Feel free to reach out if I can be a support in that. Here's just a summary slide of things that we want to be sure to kind of keep in mind. And then stay tuned because coming soon, we will have an online resource hub dedicated to supporting survivors who use substances within residential settings. And we'll have interviews with survivors, shelter directors, coalitions, and of course, advocates. We'll have program spotlights, tip sheets, and all kinds of resources. And so if there's anything that you would want to see highlighted in this online shelter hub for specific to supporting survivors who use substances, please, please, please let me know, as well as if you are someone who is working or has worked in a residential program, or you are a survivor who currently or formerly uses substances and you want to speak on your experience, please feel free to reach out to me. I would love to interview you and feature your program, or if you want to share your story and your experience, I would love to also provide a platform for your sharing of your experience. We have a lot of additional resources on our website. So we have a COVID-19 hub, we have a tip sheet for substance use disorder providers, common practices that can hurt survivors and what the alternatives are. We have a palm card on substance use coercion to really help facilitate conversations around substance use coercion. We also have a whole lot of reports on substance use coercion if you're looking for more information there, as well as several toolkits, both on substance use coercion and our accessible, culturally responsive, and trauma-informed approach, and more. So please, please, please check out all of our different resources, including like over 100 recorded webinars in our webinar library. Reach out to me if I can ever be a support. I want to say thank you, of course. Thank you to Carla for making everything run so smoothly, and thank you to all of you for being here today. And I'll open it up for, a couple questions, and then I will provide some information to close us out. So I see here that there is contact info request for Carla. So Carla, if you could go ahead and put that in the chat, thank you. I also see a question around if we have templates to use So we do have some different templates. We have things like a model medication policy. We have a template for providing emotional support and emotional safety planning. We have, but specifically for substance use management, we don't have kind of a worksheet for substance use management, but that is something that if you were thinking about specifically substance use management, that I'd be very happy to put together. So feel free to let me know if that's what you were thinking about. And then, is there an ETA on the resource hub? So we will be launching it, let's see, by this fall. So, you know, of course, as a national resource center, all of our things have to go through a very high level of review. So once that has been reviewed at that level, then we are hopeful that it will be able to be launched in the fall. So probably sometime, my guess would be November, hopefully December at the latest. So my guess is November. All right, well, with that, we have come to the end of our session. Thank you to Carla for making the webinar run smoothly. Thank you to all of you for spending your time with the center. So in the next week, or I should say within the next week, we will send you all a follow-up email with a link to the recording of today's webinar, in addition to the slides and handouts, all of which will also be available on our website. And you will also receive a certificate of attendance for your time today. At the end of the webinar, you'll be taken to a very brief evaluation. If you could please take a moment to let us know what was useful and what could have been better, it would be greatly appreciated. Thanks again, and we hope that you have a great rest of your day.